In more than half of stroke cases, the brain produces a clear distress signal hours, and sometimes even a full day, before the major event occurs. This is not a vague sensation or something you need to interpret. It is a real, identifiable warning. Yet most people either fail to notice it or feel relief when it passes and take no further action. That brief relief may, in fact, be the most dangerous moment. A physician explains that this is not theory, but practical observation, and the goal is to clearly describe what often happens before a stroke, especially in older adults, in simple terms that are easy to understand. Stroke is not always a sudden, silent event. In many cases, the body gives clear warnings before the crisis arrives. The problem is that people are never taught what those warnings look like. Inside the body, the process begins in the arteries that carry blood from the heart up to the brain. These are not just empty tubes. Their inner lining is made of delicate living cells. When this lining is healthy, blood flows smoothly, and the brain receives a stable supply of oxygen and nutrients every second. Over time, however, damage can build up. High blood sugar, elevated blood pressure, smoking, and long-term inflammation can injure this inner lining. The surface becomes rough and uneven. Cholesterol deposits and small clots begin to stick to these damaged areas. Gradually, the artery narrows more and more, not quickly, but over many years. At this stage, especially in people in their 50s, 60s, and 70s, the narrowed artery becomes unstable. Small pieces of plaque may break away. Tiny clots can form and temporarily block blood flow. When blood supply to a part of the brain is reduced even briefly, a transient ischemic attack occurs. This is a short-term interruption of blood flow. A transient ischemic attack means the blockage does not last. The clot may shift or dissolve, and circulation returns to normal. The symptoms disappear, which is exactly why it is so dangerous. People assume the problem is gone. In reality, it is a strong warning sign that a major stroke is statistically likely within the next 24 to 72 hours. This period becomes a critical window for action. Missing it can lead to permanent damage. The first warning sign often appears in the face. It is subtle and easily mistaken for fatigue, stress, or aging. A person may look in the mirror and notice that their smile feels uneven, or one side of the face seems slightly weak or numb. They might see food or liquid slipping from one side of the mouth, or feel unusual heaviness on one side of the face that was not present before. This happens because the brain region controlling facial movement is not receiving enough blood flow. Each side of the brain controls the opposite side of the face, so reduced circulation in one hemisphere affects the other side of the face. In many transient cases, this disturbance lasts only a few minutes before disappearing, leading the person to believe it was nothing serious or just a trick of perception. A simple self-check can help detect this issue. A person should try to smile and observe whether both sides move evenly. They should raise both eyebrows and see if one side responds less. They should also speak a sentence out loud and listen for any slurring or unusual speech changes. If any of these signs appear suddenly, even if they resolve within minutes, it requires immediate medical attention the same day. The second warning sign involves sudden weakness in one arm. This is different from the familiar feeling of an arm falling asleep due to pressure or position. In that common case, tingling and heaviness occur because circulation is temporarily restricted in the limb itself, and it resolves quickly once the pressure is removed. In a pre-stroke situation, the weakness appears without any physical compression or clear reason. A person may be sitting normally when one arm suddenly feels heavy, weak, or difficult to lift. It affects only one side, not both. Sometimes it is accompanied by tingling, but without any mechanical cause. This occurs because the part of the brain responsible for motor control is experiencing reduced blood flow. The communication between the brain and the arm becomes disrupted, similar to a broken phone connection, where the problem is in the network rather than the device itself. This one-sided weakness at rest should not be dismissed as simple fatigue, poor sleep position, or overuse, especially if it disappears after a short time. When someone speaks to you, whether it is your spouse, your grandchild, or a friend, their words may suddenly feel like meaningless sound. You can hear them clearly, but the meaning does not register. In the brain, language is processed by two main regions. One is responsible for producing speech, while the other is responsible for understanding it. For most people, both areas are located mainly in the left hemisphere. These regions depend on a network of blood vessels known as branches of the middle cerebral artery. When blood flow to either of these language regions is briefly interrupted, speech function breaks down in the exact ways described. If circulation returns within minutes, the symptoms disappear. Because of this temporary recovery, many people dismiss the episode as fatigue, aging, or simply a minor lapse in attention. However, this should not be ignored. A sudden and unexplained disruption in speaking or understanding language, even if it lasts only 2 or 3 minutes, is considered one of the most specific early indicators of an approaching stroke recognized in neurology. A simple practical check can be applied in daily life. If an older parent, spouse, or even yourself suddenly produces incorrect, missing, or disorganized words that were not present moments before, immediate medical evaluation is necessary on the same day. Another warning sign involves vision changes, specifically double vision or sudden darkness. There are 2 distinct visual warning patterns, though they are often confused. The first occurs when one eye suddenly becomes dark. It is not blurriness or doubling, but a true dimming effect, as if the brightness has been turned down. This usually lasts less than 1 minute before returning to normal. This happens when a small clot or fragment of plaque travels from the carotid artery in the neck upward and temporarily blocks the small artery supplying the retina of one eye. The retina, located at the back of the eye, is a direct extension of the brain. The artery that supplies it connects to the same vascular system that feeds the brain itself. Because of this connection, if a clot is able to reach the retinal artery, it may also reach arteries supplying the brain. The second type of vision problem is more severe in perception. It involves sudden double vision or loss of vision affecting the same half of the visual field in both eyes at once. This differs from a single eye blackout. It indicates reduced blood flow to the occipital lobe at the back of the brain. The occipital lobe is responsible for processing visual information from both eyes into a coherent image. When it is deprived of blood supply, vision becomes distorted or partially lost. Both types of vision symptoms, especially when they appear suddenly, last only a few minutes, and then resolve, require urgent medical evaluation. They should not be scheduled for a routine eye exam later, nor dismissed as simple eye strain or the need for new glasses. A same-day medical assessment is necessary, and if other neurological symptoms are present, immediate emergency care is required. Vision-related warning signs are often underestimated in adults over 60 and are frequently mistaken for normal eye fatigue. Another critical warning sign involves sudden loss of balance without an identifiable cause. A person may be walking through a familiar room when their coordination suddenly fails. They may step incorrectly, drift to one side, or need to steady themselves against a wall. In some cases, the sensation occurs while sitting still, presenting as sudden spinning or intense vertigo. The cerebellum, located at the base of the skull, controls balance and coordination. It continuously receives information from the eyes, inner ear, and body joints to maintain stability and movement accuracy. This region is supplied by a different set of arteries, including the vertebral arteries that run through the neck. These vessels can also develop narrowing or clots. When blood flow through them suddenly decreases, even briefly, the cerebellum loses critical input signals. The result is abrupt dizziness or loss of balance without warning or clear trigger. It is important to distinguish this from common causes of dizziness in older adults such as inner ear disorders, medication effects, or dehydration. Those conditions are real and frequent. However, a vascular-related balance event often appears alongside other neurological symptoms. When sudden vertigo occurs together with slurred speech, vision changes, or one-sided numbness, it should not be treated as a simple ear problem. That combination indicates a neurological emergency requiring immediate imaging rather than observation. Any unexplained balance episode that resolved quickly but was never medically evaluated should still be discussed with a doctor, even if it occurred months earlier, because future episodes may not resolve. Previously, one key point was left open regarding arm weakness. The most critical insight is that stroke warning signs are rarely evaluated in isolation. The highest concern arises when 2 or more symptoms appear together within the same time period. For example, one-sided arm weakness combined with speech difficulty, or vision loss in one eye paired with sudden severe headache, or balance loss occurring alongside facial drooping on one side. When multiple symptoms occur simultaneously, they indicate stress in a specific vascular territory in the brain. In such cases, immediate emergency action is required without delay, even if symptoms begin to improve. This is important because even if symptoms resolve, Medical imaging in a hospital can still identify blocked or narrowed vessels. Doctors can assess plaque buildup, measure artery narrowing, and in some cases intervene before a complete blockage occurs. The period of up to 72 hours following these warning signs is considered a critical prevention window. However, many people fail to act within it. Understanding why these events become more common with age is essential. After the age of 55, damage to arterial walls accelerates. Elevated blood sugar that caused slow changes in earlier decades becomes significantly more damaging in later life. Blood pressure that was previously tolerated by vessels now increases mechanical stress and instability in arterial walls. Two major biological processes contribute to this decline. The first is endothelial dysfunction. The inner lining of the arteries, which normally provides a smooth and regulated surface for blood flow, gradually loses its ability to function properly with age. The vessel becomes stiff, and when that rigidity combines with plaque narrowing, it creates a classic high-risk condition for stroke formation. The second major process involves a nighttime drop in blood pressure. During sleep, blood pressure naturally decreases by about 10 to 20%. For most individuals, this is a normal and healthy biological rhythm. However, in older adults who already have severe arterial narrowing due to plaque buildup, this drop can reduce blood flow through the affected artery to nearly zero. This risk increases further if a small clot has already developed during periods of low activity. In clinical practice, this pattern is often observed. A person goes to sleep without symptoms and wakes up with signs of stroke, or a family member finds them unable to speak or move. The event did not occur during physical activity. It occurred during sleep, when blood pressure quietly decreased and a narrowed artery could no longer maintain adequate circulation. This explains why symptoms that appear in the evening or overnight should not be dismissed as simple grogginess or an unusual sleeping position. If any of these warning episodes have already occurred, even in the past, there are 3 essential medical discussions to initiate with a physician. The first is a carotid ultrasound. This is a non-invasive imaging method that uses sound waves to examine the carotid arteries in the neck. It evaluates both structural condition and blood flow dynamics. A duplex carotid ultrasound provides 2 types of information at the same time: anatomical structure and functional flow measurement. When plaque narrows a carotid artery by more than approximately 70%, it is considered hemodynamically significant, meaning it can dangerously restrict blood flow. This information helps guide the next clinical decisions. The second is a hemoglobin A1C blood test. This is different from a standard fasting glucose test. Hemoglobin A1C reflects average blood sugar levels over the past 3 months by measuring how glucose binds to red blood cells. Short-term behavior cannot alter the result, making it a reliable indicator of long-term metabolic control. This test is especially important for identifying prediabetes, a condition where blood sugar is elevated enough to damage arterial walls, but not high enough to produce noticeable symptoms. In adults over 55, prediabetes can remain undetected for many years while silently contributing to vascular damage. The third is a 24-hour cardiac rhythm monitor, known as a Holter monitor. Certain heart rhythm disorders, especially atrial fibrillation, occur intermittently and unpredictably. Atrial fibrillation causes the upper chambers of the heart to beat irregularly instead of in a coordinated rhythm. This leads to blood pooling inside the heart. Within the stagnant flow, clots can form. If these clots travel to the brain, they can block an artery and cause a cardioembolic stroke, which is often severe. Many older adults experience short, intermittent episodes that are not captured during a brief office electrocardiogram because they may only last a few minutes each day. A 24-hour monitor increases the likelihood of detecting these hidden events. When atrial fibrillation is identified, medication can reduce stroke risk by 60 to 70%. Together, these 3 evaluations, carotid ultrasound, hemoglobin A1C, and Holter monitoring, provide a comprehensive view of the most common underlying stroke mechanisms in adults over 55. If any warning signs have been experienced, these are the key assessments to request. It is also critical to understand the correct immediate response to suspected transient ischemic attack or stroke warning symptoms, as well as common mistakes that can worsen outcomes. Do not attempt to drive yourself. Neurological symptoms, even if mild or temporary, can impair reaction time and coordination without full awareness. Even brief impairment at high speed creates serious risk. It is important to prepare in advance. A household plan should be discussed, including who to contact and how to respond if symptoms occur. Do not self-administer blood-thinning medication. While aspirin is often associated with heart attack prevention, stroke is not a single condition. There are two main types, one caused by blocked vessels and one caused by bleeding in the brain. Blood-thinning medication may help in one case but can be dangerous in the other. Only a brain CT scan in a hospital can determine the correct type. Medical professionals must make that decision. While waiting for emergency assistance, body positioning matters. Lying flat with slightly elevated legs can help maintain cerebral blood flow without excessive strain on the heart. The head should remain in a neutral position, neither sharply forward nor backward. Avoid exposure to excessive heat. Hot baths, very hot showers, or overheated environments can worsen instability by affecting blood vessel dilation. It is also important to keep a prepared medication list accessible. Emergency responders often lose valuable time reconstructing patient medication history. A written list or stored photo on a phone can significantly improve treatment speed during critical early minutes. To summarize, stroke remains the second leading cause of death worldwide and one of the primary causes of long-term disability. In most cases, it is preceded by warning signs that may appear hours or even a full day before the event. The key warning signs include sudden facial drooping or numbness on one side, even if brief, unexpected one-sided arm weakness at rest, sudden disruption in speech production or understanding, temporary vision changes such as one eye darkening, double vision, or partial visual loss, abrupt balance disturbance or intense vertigo without a clear trigger. When these symptoms occur together, urgency increases significantly. The period following these warning signs is a critical intervention window. Medical action during this time can prevent full stroke development. Recommended evaluations include carotid duplex ultrasound, hemoglobin A1C testing, and 24-hour Holter monitoring. These tools help identify major underlying risk factors before permanent damage occurs. The most important shift is understanding that prevention is often invisible. A stroke that does not happen leaves no dramatic moment, no warning, and no awareness that it was avoided. It simply does not occur. Daily life continues unchanged. That silent outcome is the goal. Recognizing warning signs early, acting immediately, and following through with medical evaluation can prevent irreversible neurological damage. If any part of this content matches past personal experience, it should be discussed with a medical professional without delay. Understanding and acting on these signals can protect long-term brain health and function. Please leave your thoughts about this content in the comments below. Thanks for watching. See you in the next one.